Hello, I'm Dr. Maria Solindro, specializing in integrative medicine, practicing in Pasadena, California. I'll be most grateful if you subscribe, like, and share my channel. Today, the topic is aneurysm, which is the time bomb in our body. Some of you might be wondering why and what does aneurysm mean? An aneurysm is an abnormal bulge or ballooning in a wall in a blood vessels caused by a weakness in that vessel's wall, usually where it branches. A proportion of these patients will go on to have a rupture. I'd like to share with you a picture. This one is an artery, a picture of an artery in the brain. And this is the branches I'm talking about. And for sometimes unknown reason, this area here is weakened and the wall will actually bulge. And so this is what we call aneurysm. And if looking at the whole head and with the brain, this one small aneurysm here, if you enlarge it, it will look like this one. So this is where what we call time bomb, because you do not know when this one will rupture. So that is called ruptured aneurysm if it's ruptured. There are several places in our body where aneurysm can happen. In the brain, it's called cerebral aneurysm. In the abdominal, it's called aortic aneurysm, abdominal aortic aneurysm. This is called AAA. Neck, in the area of the neck here, intestine, kidney, spleen, blood vessel in the leg, in the iliac area where the groin is, femoral or popliteal aneurysm. The most common type of an aneurysm is the aorta. The aorta is the largest artery in the body. Aorta carries oxygenated blood from the heart to the body. There are two types or two areas. One is thoracic aorta aneurysm is a type of that occurs in the chest cavity. The second one is abdominal and aortic aneurysm occurs in the abdominal area. Aneurysms in the picture, I will share with you again what is the aortic aneurysm and cerebral and ventricular aneurysm. The aortic aneurysm, as the name suggested, this is the type happens in your aorta. It can be linked with hardening of the arteries, also known as arteriosclerosis. And it may be inherited condition or a compilation of high blood pressure or smoking. Now, cerebral aneurysm, also known as berry aneurysm, you get this kind in the wall of blood vessels in your brain. Ventricular, ventricular aneurysm, it is the bulge in the wall of your heart. A previous heart attack is the most common cause. In the rare cases, it is a severe chest injury can also lead to that. I'm going to share with you again this picture. On the left side is a normal anatomy of the abdominal area. The blue one is the vein and the red one is the artery, or this is called a big artery, is called aorta, abdominal aorta. Now, if you go to the right side here, you can see abdominal aorta aneurysm. So you can see the large ballooning area of the aorta. This can be like three times as big, and it can rupture. That is the most problematic one when it's ruptured. When it is in the head like this, okay, this aneurysm is also in two different area, also in the branches area there, and it can rupture. Now, this will cause a lot of symptoms and big headache, and so this is called cerebral aneurysm. This is the ventricular aneurysm, and usually it is also accompanied by an abnormal EKG showing the persistent ST segment elevation. This one is the ventricular aneurysm, a huge one in the wall of the heart in the ventricular area. Let's talk about the statistic. Okay, the statistic and how often this disease is found. Who has this kind of risk of aneurysm? So aneurysm is most often developed in an artery rather than the vein. What happened when it burst, right? So approximately 6.5 million aneurysm is diagnosed every year in United States. The rate of the rupture is 1 in 50 people, about every 18 minutes. And so there are about 30,000 will suffer aneurysm rupture every year in United States. You're at a higher risk of aneurysm if you have atherosclerosis. And this is a disease of the arteries. It's characterized by the deposition of the plaque of the fatty material on the inner walls. The risk factors of aneurysm that you cannot control is gender, male, older age, family history, and genetic factors. These you cannot control. But the risk factors you can control that includes high cholesterol, high blood pressure, smoking habit, diabetes, and obesity. Do you know if the cause of brain aneurysm can be unknown? Well, brain aneurysm develop as a result of thinning of the artery walls. The aneurysm often forms at the fork or branches of the arteries. Like strong emotions, such as being upset or angry, can raise blood pressure and can subsequently cause aneurysm or rupture. There are several reasons, although, like I said, an exact cause isn't very clear or isn't always clear. One kind is called mycotic aneurysms. These are caused by infections of the artery wall. The brain requires a large supplies of blood delivered via four main blood vessels that run up the neck into the brain. These blood vessels divided into smaller smaller vessels in the same way as trunk of a tree divides into branches and twigs. Most aneurysm develops at the points where the blood vessels divides and branch off, and these areas are often weaker. What are the symptoms? Is we have to pay attention because these symptoms is very general. A brain aneurysm rarely causes any symptoms unless it bursts. But the unruptured brain aneurysm occasionally cause symptoms if they are particularly large or pressed against tissue or nerve inside the brain. Then you can feel that. Symptoms of the unruptured brain aneurysms can include visual disturbance, such as lost vision, double vision, pain above and around the eyes, numbness, weakness of one side of the body or face, difficulty sleeping, difficulty speaking. Some people have developed headaches, which is very common. Like headaches is common. And then loss of balance, difficulty concentrating, or problems with short-term memory. You should see your doctor when you have all these symptoms and as soon as possible. If you experience these symptoms of unruptured brain, you're very lucky because you don't want to wait until the aneurysm burst. Although aneurysm, most of them will not rupture, it is important to get it checked and the case in case the treatment is possible or necessary. Although most aneurysm um, will give you like a very general common symptoms, I will share with you one slides here that will give you an idea how common it is. Okay. Type of aneurysm. This is the AAA, the abdominal aortic aneurysms. Um, it gives you constant pain in the abdomen area, chest, low back, or groin area. Now, isn't that a common pain area? But if it's persistent and you are wondering why you cannot get rid of the pain, you should see your doctor. Now, cerebral aneurysm in the brain, sudden severe headaches, nausea, vomiting, visual disturbance, loss of consciousness. This is not common, right? So you have to see a doctor. Common iliac aneurysm, lower abdominal pain, back or groin pain. Now, those are still common, and but you, if it is persistent, you have to see your doctor. Okay. How do we diagnose it? Now, you are wondering how we do it. Well, we, along with the complete medical history and physical examination, tests, we schedule the test for aneurysm. This can include a CT scan. This is an imaging of test using an X-rays and computer technology. It has a radiation. The second one would be MRI. Use large magnet. This has no radiation, and magnet and radio wave actually, and a computer to make detailed images of organs and structures in your body. Echocardiogram or this procedure is using ultrasound, recorded a moving picture of the heart and heart valves. Now I do this for my patient every year, once a year. An arteriogram or angiogram. This is an X-ray. Has a radiation. This is an X-ray image of the blood vessels used to evaluate various conditions such as aneurysm, stenosis, or narrowing of the blood vessel or blockages. We use a contrast or dyes, and these will be injected through a thin, flexible tube placed in an artery. These dyes or contrast will make the blood vessel visible on the X-ray. Ultrasound. I do also this in my office for patients every year. This is using of high frequency sound waves. An ultrasound is used to view internal organ in the and as they functioned, and this is used to access blood flow through various vessels. We talk about the rupture of the aneurysm, how dangerous it is. Symptoms of ruptured brain aneurysm usually begin with a sudden agonizing headaches. It is been likened to being hit on the head, resulting a blinding pain unlike anything experienced before. So when you feel something like that, it's an emergency, 911. Other symptoms can include feeling of or being sick, stiff neck, neck pain. Some of the patient cannot even move. I have a patient who had experienced two aneurysm, and she was just like stuck in one position. She knew then that this is aneurysm, so she called her son. Luckily, her son was available and rushed her to the emergency hospital, and she was safe for the second time. It's amazing. Sensitive to light can be blurred and double visioned, sudden confusion, loss of consciousness, and many will get seizure reaction or weakness of one side of the body or limb. It's just like a ruptured hemorrhage or stroke with hemorrhage problem. Ruptured brain aneurysms is, like I said, 911 medical emergency. Immediately call a 911 and ask for an ambulance if someone experiencing those symptoms, or if you're alone and if you still can call 911, do it. I would like to share with you one more time. It's so that you can see what kind of situation when it's ruptured. Okay. Now, this one, there are three different kind of example. One is called saccular aneurysm, and this one is fusiform aneurysm. One is round and one is torpedo torpedo shape, right? And this one when it's ruptured. This is ruptured aneurysm. Now, this is the brain. This is the base of the brain or cerebellum, and this is cerebrum or the large brain and the small brain. Now, there is an area where the four of the large vessel meet. This is called circle of Willis. And you can see one of the artery here is enlarged. This is the fusiform aneurysm, and it can rupture. When it's ruptured, the blood will actually compress against part of the brain, and whatever the function of this part of the brain will actually become paralyzed because it is compressed. How about talking about treatment option, right? Treatment option may include just monitoring the patient. So if there is a small size and we monitor this aneurysm with the rate of growth, and this is done with ultrasound. It can be 6 months or every 12 months. In my clinic, if in my office, if I see a patient with aneurysm, I refer them to a specialist of that particular area. This is part of what we call watchful waiting approach for a smaller aneurysm. So, or we can manage the risk factor at the same time. This is done in my office also. I tell them steps such as quitting their habit like smoking or drinking alcohol, controlling blood sugar if they have diabetes, or losing weight if they are overweight, controlling dietary fat intake. This may help to control progression of the aneurysm itself. I can also prescribe them medication if they have high cholesterol or if they have high blood pressure. And surgical repair. Now, this one I don't do. And this one I refer them to like neurosurgeon for the brain, or thoracic surgeon, or a vascular surgeon, okay, who does this repair. Some of the surgeons are not like endo or neurovascular specialty, so they know who to send if they cannot handle. The surgical repair of the aneurysm can be done with large incision and graft, or with smaller incision and X-ray images and stent graft combination. So I'm going to also share again with you some of this picture. Mhm. Yes. On the left side, you can see this is the artery, and this is what we call endovascular coiling. So you insert a coil here and you fill the aneurysm with coils. This way, we protect this area where the wall is thin so that the pressure will go here or will go the other side, right? So let me see, return. Yes. Oh, how do I do this? Okay, let me go back here. Yes, so this one is called endovascular coiling. It's one way to do it. This is done by the surgeon, not by me. On the right side here is called microsurgical clipping. You can clip at the bottom here. This one is an example of ruptured aneurysm. And this is the artery. And you just clip here. And this is one of the most common procedure done. And this one is called Onyx Embolization or solid liquid ball, glue ball. So what they do, they insert like a stent there, and then they use a catheter and they fill the aneurysm with a glue. So this way, this will not be disturbed again by any pressure. Okay. Next one, this is the artery, this is the aneurysm. So you want to put a stent here. This is called flow diverter. So you divert the flow of the pressure when the blood flow. So the because it's now there is a stent here, right? Like a ring here. So it will not blood will not flow here. So this area is safe. It's called FD, okay, flow diverter. All right. Now, is there any way to prevent brain aneurysm to rupture? You cannot always prevent brain aneurysm to rupture, but you can lower your risk. Lowering your high blood pressure by eating healthy diet, in particular cutting down on salt and eating plenty of fruit and vegetable. Salt is about like 6 grams a day or 1 teaspoonful. Need to select a good salt, okay, non-processed salt like sea salt, Himalayan salt. I do endorse Dr. Jonathan Wright salt because it is not for people who are salt sensitive. Sensitive, you have to look for the salt that you can take, but and don't if you don't want to use salt is even better. Moderating your alcohol intake, men and women, that you are not to regularly drink, but limit your drink like maybe 14 units a week. Maintaining healthy weight. Even losing just a few pounds will make a big difference to your blood pressure and overall health. So lowering your BMI. Exercise on a regular basis, being active and taking regular exercise lowers blood pressure, and by keeping your heart and blood vessels in good condition. Cutting down caffeine. It is fine to drink tea, coffee, and other caffeine rich drinks as part of your balanced diet balance, but it is important to make sure that these drinks are not your only source of liquid. Some people just drink tea and they don't drink water. So make sure you drink good water, not tap water, and body's weight in pound divided by 2 is equal total ounces of water you need per day. That's minimum. You can drink more. All right. And when you drink, make sure your body once in a while test it. If the pH of the urine is between 7 or 8, you're good. But if not, just try to drink alkaline water or food that are more alkaline. Those are like non-meat, non-nuts, okay, fruits and vegetable, they're alkaline fishes, they're okay. And most important, drink water. Until your aneurysm reaches the point where it needs to be repaired, it is very important to follow your doctor's advice closely. Have an ultrasound screening done as often as advised. Take medicine as prescribed, please. What are the best medical treatment for brain aneurysm? So, whether medicine is recommended depend on your blood pressure reading and your risk developing problems such as heart attack or strokes. Be careful, heart attack and strokes are two major cause of death in the whole world. So make sure you remember lifestyle changes to lessen your blood pressure make it normal, hopefully, and also your lipid, because the unstable protein is the cause of stroke. After I explained the whole thing like that, you probably wonder, wow, headaches, abdominal pain. But most important is, remember, those symptoms usually are persistent. It's kind of very hard to get rid of. Okay. Now, I would like to bring you to a take home message. And these symptoms are so general. What to do to get most from a visit to your doctor or to me? There are 10 tips. Very easy. Many of my patients have done this, and I noticed they're very good in it. So, number one, make sure you know that if you come to my office, you can record whatever I explain. I have a tendency to speak very fast, especially when I explain about your pages and pages of a blood test, right? So, number one, you have to know the reason for your visit to a doctor and what you want to happen. Okay, you just imagine. So, at home, you start number two, write down all questions you want answered. So before your visit, you do this. That's number two. Number three, bring someone with you if you cannot speak the language to help you ask questions and remember what your provider or your doctor tells you. So this person will help you to remember. Sometimes a patient that comes to me, they realize they have short-term memory. That's the reason why I said just record the whole conversation. So they turn on the recorder the whole uh, consult during consultation. Number four, at the visit, during the visit, you write down the name of new diagnosis, any new medication, any new treatments, or any test I recommend. Also, write down any new instruction of what I give you when I give you medication or treatments. For example, like an IV treatment can be weekly or twice a week. I usually write in my recommendation, and then you get a copy when you leave. So, uh, unfortunately, some of my patients uh, do not read my handwritings that are so beautiful, like calligraphy. So the fifth one, know what a new medications or treatment is prescribed. So if I prescribe you medication, you have to ask why. Okay, what medication for which reason and how it will help you. Also know what the side effects are of the medication. Many times, like almost 80%, 90%, I don't write a prescription for you, but I try using in complementary medications. Complementary medication, I usually use food supplement that are GRAS, generally recognized as safe. So do not have side effects. But prescription medication have side effects, and the side effects usually the pharmacy will give you a slip when they give you the medication, and you read in that slip what the side effects are. Number six, how many portions of treatment are there? I mean, how many options of treatments are there? So if I give you one treatment, you said, is there any other option? I usually explain if you have option one, option two, option three. Usually it depends on if there are costs involved. So, you have to think very carefully. Number seven, know why a test or procedure is recommended. So if I recommend you to have like maybe bone density or DEXA bone, or in this case for aneurysm, you don't have bone density, but you have ultrasound or you have an echocardiogram. So then you have to ask why. So I said, oh, okay, this is to make sure that you do not develop aneurysm, and I repeat this every year. And my patient all know about this. So number eight, You have to know what to expect if you do not take that medication I give you, regardless it's a grass, medical food, or prescription. But you have to know what if you don't take it, what happened, and if you don't take the test or the procedure I recommended, and ask clearly what will happen. Okay. Number nine, if you have a follow up appointment, very important, make sure you write it down, the date and the time, and the purpose of that follow up. You can ask also. And please do not forget, because we don't double book. And so if you do not show up, and then that hour is wasted, right? Now, the last one, number 10, you know how you can contact your doctor if you have an emergency or if you have any question. In my clinic, we or office, we do not take emergency. We all tell the patient, if you have emergency and you think it's an emergency, call 911. But if not, if you can wait the next day, you can call us and in the morning from 9 until 5 o'clock. Thank you very much for listening, and I hope this will be very helpful. Again, I'll be very grateful if you um, share and subscribe and like this video. And please join us again next week. We are also in Instagram by the name ASKDR Maria, Ask Dr. Maria, and also in Facebook with the same channel, which is called Dr. Maria Aesthetic and Anti-Aging. So please join us next week. Thank you so much.